Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is episode 225, and I have a very, very special guest here with me today. I have someone who's a friend, somebody who is an absolutely incredible Medicare advocate for people in the state of Texas. I have Rebecca Davis here with me today, who's the founder, and would you say the CEO and the founder of Cannonball Insurance Services?
Yes, I would.
Okay. Just want to make sure I get the title right. That's always my problem. Like I'll start like putting out titles and they'll be like, well, actually I'm the COO or the CFO. I'm like, oh, well, I'm sorry. Rebecca, thank you for being here. Thanks for taking some time.
Oh, absolutely, Christian. I'm a huge fan of yours, and I can't wait to do this with you.
Hey, well, it's always a pleasure. And I was kind of thinking back on it before when we were talking about doing this, and I was like, we've never had you on the podcast before. I know we've done some other collaborations before, but we've never actually done an interview on this platform before, and I was like, that's a shame. And so I'm just really glad we were able to kind of link up. Rebecca, for anybody that doesn't know you, why don't you give us a little bit of information on your background and kind of how you got into the insurance business and just a little bit of info about your company before we get started?
Absolutely. I got started in this business about 8 years ago. I actually got started with a local, well-known brand, State Farm, where I did everything. My son actually got me in the business when I had him. I decided I wanted a regular job where I wasn't just working weekends, holidays, and crazy hours. And I kind of fell in love with the business and decided to go out on my own and specifically specialize in health and Medicare. I really enjoyed that side of it, and I felt like that was the biggest need out there for people really understanding what was going on, because it's right when, Medicare and Medicare Advantage was coming into play, and the whole AC and Obamacare is coming to play, and all these changes, and people were just so confused. So I just felt the timing was right to really specialize in something health related. And so that's how I came to be. And we're here in Texas, and I love it, and we've branched out. We're in about 10 states now, but Texas is definitely home base.
Gotcha. Well, we're kind of anticipating open enrollment to be, this will air right in the right depth set in the middle of it, but we're kind of anticipating open enrollment to be a little chaotic this year in terms of changes. Is there any kind of trend you're seeing with some of the plans there locally that might be interesting to people that might be listening from Texas? Like, are there any benefits you're seeing that are coming into play that maybe you didn't see before? Or talk to us a little bit about that.
There is definitely one benefit on the Medicare Advantage that I'm seeing a trend on that is actually brand new, and that is the healthy food card benefit. Yes. So for your lower income people, they're throwing in a healthy food card where you can go and get groceries at a lot of our name brand local companies here in Texas. And at first I thought it was just one carrier doing it, but come to find out after, listening to everything and reading through the books and stuff, that several of the carriers are actually doing it now. So I think that's a really neat feature. Healthy food is generally more expensive food to get. And right. So I think that's a great feature for the lower income seniors, so they can get those fresh vegetables and maybe those better cuts of meat and stuff and help with their longevity.
I think Advantage plans do. It seems like agents are usually on like one side of the fence with Advantage plans. They either hate them or they love them. I feel like Advantage plans do such a great job in terms of, really promoting good health and wellness and that kind of stuff. And like, not to say that, original Medicare doesn't, but there's not maybe as much of an emphasis. Would you say that's accurate?
I agree. I think the Advantage plans do definitely get you some benefits that you wouldn't normally be able to get on your own, or maybe on your own they would maybe unattainable because it'd be too expensive. Where the Advantage plans really does put it into a nice little bundle that is affordable. The copays are in there. We all know this. It's kind of
Mm-hmm.
a pay-as-you-go type plan, but the copays are generally very small and very affordable too. I mean, I'm a fan. I'm a fan of both. Honestly,
Right.
we do both here at the office. It's really up to the client what's going to fit their needs best. But no, I agree. I mean, there's a lot of things those Advantage plans do that are actually pretty neat. I kind of wish we could get them at our age.
Right. Seriously, like it blows my health insurance out of the water. Like the
Oh,
worst Advantage
absolutely.
plan is 10 times better than my health insurance plan. And people are like, how is that possible? I'm like, I don't qualify. I'm like, there's nothing I can do about it. But like, um, it's kind of interesting. One thing I was curious to kind of get your perspective on is Texas Medicare supplement rates. How are they looking for 2021?
Actually, from what I've seen so far, they're actually looking fantastic. We've been writing some recent MedSet business, and the rates are about as low as I've ever seen them.
It's
So for
crazy.
people maybe possibly been on a MedSet for a long time, this might be a good upcoming year to reevaluate your MedSep and possibly get the same plan to switch your carrier and get a better price, reevaluate it. Because there's a lot of new old carriers with new plans that are still the same plan. They just put a different name to it, and they're
Mhm.
they're basically fighting for the business. So they got some amazing rates out there right now.
I love to see that. I love to see that. Like I know this year in Utah anyway, we had probably there are two biggest med sup companies by market share. Both of them lowered prices this year for new customers. They didn't raise them. And then on existing blocks, some existing blocks they had low, they lowered the rates instead of actually even having a rate increase. And
Mhm.
so it's been I think a really great year for med sup business. I mean, I know that's not the
Yeah,
case everywhere, but
I've seen them go a little both ways a little bit this year,
yeah.
but with those new plans with those name brand carriers, they're really fighting for the business. And then there's one carrier that flat said because of COVID, they are locking their rates in and they ain't going to touch them, guaranteed for a year, no matter what.
Whew, that's huge.
Yep.
That's gigantic.
So people that are on that plan that have been on it for a while, they're not going to get a rate increase this year, and they'll be pleasantly surprised.
Yeah, I'm sure they'll be tickled pink with that. Um,
Yes.
Rebecca, you've been in the business about 8 years now. This isn't your first rodeo in terms of AEP. For those of you who are listening that might not know what AEP stands for, AEP stands for Annual Election Period, which is basically the Medicare open enrollment period. Um, this isn't your first rodeo, though. You've been through it multiple times. You've probably seen a lot of trends, as have I, right, over the years in terms of like patterns people do. They seem to like maybe do the same thing year after year in terms of like maybe something that drives you nuts that you wish people wouldn't do in terms of like, don't do that. It's not good for you. It's a mistake. Is there a couple of things that come to mind in terms of like mistakes people make during open enrollment that they could easily avoid themselves some trouble, some pain?
Oh, absolutely. One, I think it comes to the TV commercials. Those
Yes.
commercials are so enticing, and that it's so easy to dial that 800 number while you're sitting in front of it. And those people are so well trained on the back, whether you actually wanted to switch or not. Sometimes you end up getting switched or switching yourself by mistake, and you don't even realize it. Or you cross counties with your commercials, and what they're advertising in your county doesn't even exist,
Yeah.
and you're calling it up trying to get a plan that does not exist. It's so frustrating for them. And then they call us and be like, they told us we can't get a plan. I'm like, well, unfortunately it's not actually in our county just because they're advertising it here. It's just not. I'm sorry.
Yeah.
And that gets frustrating for them as well. They get some amazing ad and then they find out later that they can't get it. I mean, it's frustrating for both ends.
Right. Right. I mean, for the longest time, they would run advertisements on TV commercials here in Utah advertising a Part B reduction, which is available in a lot of states. For those of you who don't know what a Part B reduction is, it's basically if a Medicare Advantage carrier will basically reimburse a portion. It could be a small amount, it could be a larger amount of your Medicare Part B premium back into your Social Security check. And it's very prominent in a lot of areas in the country. But here in Utah, we haven't had anything like that for years, even before I was even in the business. But they'd run ads that was like the highlight of the commercial, And we've gotten so many calls about it. Now, this upcoming season, we've had a couple of new plans come into the market that offered that for the first time in God knows how long. But it's frustrating for people because they don't always know who to listen to, and then once they actually find out that it's true, they got their hopes up for nothing. It's really unfortunate sometimes.
Well, and those particular plans that you're talking about it's also a catch-22 because they don't.
Mhm.
When you're watching the commercials, you get so caught up in the give back that you miss the part where they say, oh, by the way, prescription drugs are included in this plan.
Right.
And you switch, and then come January 1, you realize you have no prescription drug coverage. And all of a sudden, you're in a big problem because now you got a $300 prescription bill that you're supposed to have because you have no drug coverage. And I think that's the scariest thing about those give back plans when a consumer sees it on TV and maybe doesn't see the fine print or hear the fine print on something like that.
Yeah,
for sure.
Of course, not all the give back plans. Just some don't have drug coverage, but
well, all the ones in Texas, unless it's a dual.
Oh, gotcha. Okay.
It is an MA only plan.
Okay.
So no prescription drugs.
Gotcha.
Here it's geared towards the vets because they can get their prescriptions at the VA, which makes sense.
Yeah.
But for the local consumer who doesn't quite understand that part of the plan, they can lose their drug coverage.
Yeah, that's not good. That's not good. I know like in some markets in like Florida, we do a lot of business in Florida. There's a lot of give back plans there that do have drug coverage, but I know like in Utah, we've had 3 plans have give back for this upcoming season. 2 of them don't have drug coverage, like just like the ones in Texas, but then one of them does. So I think definitely depends on the plan, but in Texas, be aware of that. If you're in Texas and you're going for a give back plan, beware. That's never a pleasant surprise to January 1st, you try to get a prescription, you can't.
And keep in mind, give back is different than extra help or Medicaid reimbursement too. And the consumers need to be aware of that because they may qualify for one and not the other, or vice versa.
What part of Texas are you guys located in? Remind me.
We are technically, we would be considered, I guess, north, almost dead north, middle, kind of west. We're an hour and a half from DFW Airport, southwest. So I'm right between Fort Worth and a town called Abilene, which if you live in Texas, it's another pretty big town.
Gotcha.
We're 3 hours to the Oklahoma border. We're like 10 hours to the New Mexico border and like 8 hours to the Arkansas border. So we're pretty dead smack in the middle.
You're close to everything.
Yeah, in Texas.
In Texas. One last question I have for you. What is your opinion on people this upcoming open enrollment period doing things with an agent face-to-face? Do you think it's okay as long as they're taking precautions and wearing masks, or are you encouraging your clients to kind of do more stuff over the phone? What is your guys' approach with that?
Well, I mean, yes, you need to be careful. I think you need to pay attention to your surroundings, kind of no matter whether it's open enrollment or just going to the grocery store, especially if you're a senior, and especially if you're a senior with health problems. We do face-to-face here in the office. My agents are all well over 6 feet apart, the way my office is laid out. So the only person you're in somewhat close contact with is the actual agent you're dealing with. We have kept ourselves in a very tight niche situation since the start of COVID, and knock on wood, we haven't had any issues. And like I said, knock on wood. And then as far as in-home goes, that's really up to the client. If you can space each other, and I would refrain from shaking hands or hugging, which we all like to do, especially with seniors that are maybe our current clients and we're just revisiting them and we haven't seen them. You want to give them a hug, but refrain from that. And I wouldn't stack appointments so close together. I would give time for to kind of disinfect and sanitize, so to speak, between you seeing people. If you're in an office, disinfect your desk, wipe things down, spray the chairs. It's just a matter of taking those extra steps. And I think as long as you do that and the seniors are comfortable with your situation, I mean, absolutely. But there are those ones that have tremendous health problems, and if they can do it online or over the phone, if you're a high risk, I would suggest doing it that way. If you're afraid to go to the grocery store, then I want to meet with you just like we're meeting right now on a Zoom or over the phone or something. And Your health is your number one priority, and the only one that can truly decide what's best for you is you. And, so
Right.
it's a lot of that. They need to make that decision, and they need to not be afraid to tell you as an agent, what they want. They need to be, speak up. We're here to help them, and we're going to do anything we can to help them.
Well, I like that. I think that's a great approach. And I agree. I agree 100%. Last question I had for you, Rebecca, and then I'll get out of your hair for the night. But one thing I really admire about your organization, and I think you guys do a fantastic job at, is you guys do a lot of incredibly fun and creative activities for seniors in the area, and a lot of different kinds of events. Do you have anything exciting that's planned for this upcoming open enrollment period in terms of that?
Well, we're still working on open enrollment specifically. Our first event, we actually have one in October towards the end. We're doing the local chamber mixer here at our office, and where the town folk get to come in. We're going to have the office all decorated up Halloween, and we're going to be in Halloween costumes, and everybody's welcome. That's technically our first big face-to-face event probably since COVID started, so we're looking forward to it. But at the same time, it's going to kind of set the pace, I think, for the rest of the year on
Right.
what we feel like we can and can't do because of the current situation. So we're kind of waiting to see how that goes. Now, I do have my office set up as a resource center with multiple carriers for people to come in, walk in at any time, or if they call the local carrier and they don't want to do something over the phone, they want to actually physically walk into an office, we are set up that way. And that's already pre-set up and things like that. But as far as we will do something, I always do something for Christmas. I always do something for Thanksgiving. Usually we pick a couple of families out and deliver full Thanksgiving meals. That's past what we've normally done, and we do pictures with Santa. We always do stuff like that. We will definitely do stuff like that this year. We just got to gauge exactly how is the best way to handle it though for this year.
Yeah. Well, I think it's great. And I'm hoping that it goes well. And if you're in the area, check it out. I mean, nobody throws a party quite like Rebecca. They call her the Medicare Wonder Woman for a reason. Rebecca, thank you so much for taking some time and being on here. How can people, if they hear this, if they want to get in touch with your company this upcoming open enrollment period to maybe have you review their Medicare plan, what's the best way to get in touch with you?
Oh, absolutely. Thank you, Brindle. There are several ways to get in touch with me. I'm pretty easy to get a hold of. You can go to our website if you're internet friendly. It's www.kbisolutions.com. You can find us on there. You can call me at the office at 254-918-5444. Or if you're a Facebook junkie, you can look me up on Facebook, either Rebecca Davis, the Medicare Wonder Woman, or any of the above. You will find me. My profile is public and there for everybody and anybody who has questions. And if you're not in my area, I have agents all over that I can get to you. Or if I don't even have an agent in you, I know Christian could be there, or he might have a team member there. We will get you hooked up with somebody that is knowledgeable and will serve your needs to the best they can.
Well, fantastic. Well, thank you so much for taking the time. Everybody, if you live in Texas, or maybe if you live in another state, and you really resonated with something that Rebecca said, give her a call this open enrollment period. She's a fantastic professional and she knows her stuff, and she's there to help you. So, Rebecca, thanks for taking the time and kind of bringing that value and that perspective for open enrollment for everybody that listens, but also mainly for that Texas audience. I thought that was kind of interesting to kind of be able to look at that one area and kind of see how things are going. So we appreciate you, and keep doing what you do. You guys do a great job.
Thanks, Christian. I appreciate everything you do. And if you're in Utah, Christian is your man. He is an amazing, amazing agent. And if you haven't met him yet, you need to.
Thank you. I appreciate it. Everybody, thanks so much for taking the time and listening today. If you haven't already, and you're listening to us on a platform that allows you to do so, please do us a favor. Leave us a 5-star review. It helps us reach more people just like you who need to hear our message. And until next time, take care. Have a great day. And make sure to make good decisions this AEP.